Welcome to my How Healthy Are You weekly educational podcast. My name is Dr. Thomas Brewer. I'm a PhD chemist and nutritional blood microscopist. Today is July 26, 2021. In this podcast, I'm going to be talking about nail health. And I got this idea from a client that had bulging fingernails. So I decided to do a podcast on 9 symptoms where one can look at their nails and determine a potential cause of that problem. Now, last week I talked about nail fungus a little bit in the newsletter, and I mentioned some essential oils to use. And so this is sort of a continuation from the newsletter, not the podcast, but the newsletter. Now, something similar to being able to look at your nails and determine something that could be potentially wrong. You can also do this with your eyebrows. If your eyebrows are a little short, meaning they don't go all the way across your eye, it normally means thyroid, and it's a pretty good test. So if you have short eyebrows, sometimes they're only like half as wide as they should be, it's typically a thyroid problem. Another easy test is looking at the color of your urine. If your urine is pale yellow, that's great. The more yellow it is, you start approaching problems, or even just not metabolizing B vitamins, meaning you're taking too many B vitamins, all the way up to urine looking like apple juice. That is severe dehydration. You can also look at your stools. Stools should be about 8 to 12 inches long and very thick, say 1 to inch and a half, even wider. So these, stools should be very large and bulky, and most people never see a stool like that, which means they're not eating right and they're not digesting their food correctly. So these are just some simple things. So today, though, I'm going to go into 9 symptoms with nails. So like this client he had these bulging fingernails. Now, that is called clubbing. And what happens is there's too much tissue around the ends of the fingers. What this typically means is liver disease, though it could have some pulmonary disease also, even IBS, irritable bowel disease or irritable bowel syndrome. So we can determine what the actual issue is if we were to combine something like seeing clubbing and along with these other nail symptoms with a blood microscopy, so we can nail down which it is, because you're going to realize as I go through this podcast, there's a lot of overlap with liver and cardiovascular issues. And how would you tell? Well, you'll need some other tests. Remember, this is just a quick visual test. Essentially, it's qualitative analysis. It is not quantitative. Okay, the second one would be red nails. So that means instead of having healthy pink tissue when you look through your nail, it's very red. And this typically means heart disease. Again, can be confirmed by finding plaque during a blood microscopy. Now, white under the nails is more liver or diabetes, and we're going to have some other issues, conditions that will lead to liver or diabetes, but the white tissue under the nails were essentially, instead of it being pink, it's white, liver or diabetes. Okay, the fourth one is when the nail separates from the nail bed, so it's essentially raised. And in this case, the nail will look white. I've seen this on numerous people. Usually the cause is psoriasis, but it can also be caused from some sort of trauma and thyroid. So again, it's hard to really pin these down without a secondary test. The fifth one is red lines at the base of the nail. So these are going to be irregular, not too common to see, and the reason it's not too common, it typically indicates lupus, and lupus is a quite severe issue, and it's something really to fix. A lot of it can be done with diet and, of course, enzymes. The sixth one is when your nail is half white and half pink. It has a name called Lindsay's nails, and definitely kidney disease. This is quite serious. So when the nail is half white and half pink, and normally it's mainly pink, so half white, half pink, kidney disease, something to get checked out, and it's quite serious. Now, what is fairly common, I would call this the second most common issue, is brittle nail syndrome. So this is when the nails start splitting. Usually they split right down the middle, whether it's a horizontal or a vertical split. And a couple of things, often it's iron deficiency, but also this can be caused from wetting and drying the nails. So from cosmetics, nail cosmetics that is, or any serious injury. But again, this one too is possibly from psoriasis. What I consider the most common issue, they're known as Bowes lines, and that's the line that runs right across the nail. It's extremely common. And what this means is a calcium deficiency. That's normally the cause. That's why when I see those lines on people, I know they need to consume more green leafy vegetables or other green vegetables like asparagus and broccoli. That it's a sign that they need calcium. One other thing is just to supplement with the coral calcium if you can't get enough calcium from your diet. Now, those lines can also be a sign for diabetes and zinc deficiency. So we have calcium deficiency and possibly zinc deficiency. To a lesser extent, it indicates vascular disease or cardiovascular disease. It's usually the calcium or the zinc that is the cause of those lines. Now, my ninth one and final one is known as yellow nail syndrome. What this typically means is someone has some lung issues like emphysema, some bronchial problem. Sometimes it's caused from the polish. So if the yellow nail has it isn't complete, it has a little bit of white at the base, that's a really clear sign for diabetes. So that's 9 symptoms that you can look for, and I gave you some indicators on what that really could mean. I got a lot of this information from Dr. Adigan, who is not only a dermatologist, but he's a nail disorder specialist. Now, a couple of tips. So I noticed 2 really good tips for people to help their nails. One is about replenishing moisture, and this is especially important for mainly women that use nail polish and they have to remove it, and then their nails get quite dry. So the remover is really acetone-based, and it's really some nasty stuff. But it's going to remove a lot of the moisture from your nails. So an easy way to get moisture back into your nails, a nice little trick, is just to use coconut oil and rub your nails and try to get it into the cuticles a little bit. That nice, simple way to get moisture back to the nails. And speaking of the cuticles, the second tip is don't remove or push your cuticles too much or clean too deep under your nails. Try to leave them be as much as possible. All right, so that's what I have for this podcast. I want to thank everyone for listening, and please don't keep me a secret.